Next we have Dr. Britt, graduate of IU School of Medicine. She's practiced medicine here in Jefferson County for 11 years. If you don't know, Dr. Britt actually took healthcare reform into his own hands, opened his own clinic, because he felt like he could do a better job for his patients. It's my privilege to introduce Dr. Britt.
Thank you. You know, what he said is true. I try to take it in my own hands, and I thought I could do maybe a little bit better by the people I take care of. And every day, especially this last 18 months, I keep getting asked the same question by everybody. You know, how's this going to affect me? What's this going to do? And in the beginning, I was hopeful. I mean, I'm an optimist, and I was thinking, you know, maybe it won't be as bad as I'm afraid of. I was a little leery about the people steering the wheel, you know, what was going to happen. And I sat there and I waited and I watched and I read and I listened. And when this bill, as far as the little pieces start to trickle out, I was a little disappointed. You know, there's two things that I see wrong with health care. And I'm sure there's a lot of little bits and pieces you could argue. But honestly, I see two big problems with it. And it's not that there's, you know, 30 million, 20 million, 40 million, or whatever uninsured. I mean, that's a problem. That's not one of the two big problems. It's not that the costs keep going up and up and up. That's a problem. That's not one of the big problems as far as I see it. It's not, you know, the insurance companies per se. It's not, you know, Medicaid per se. I think one of the biggest problems I see is the frivolous lawsuits. And what the other side will say is they'll say, well, you know, your malpractice premiums, they account what, 1-2% of healthcare costs? But it's the mentality, and when I was in med school, I'm sure Dr. Israel will attest to this, they're constantly telling you, if you don't do this and you get sued, you're dead. I mean, you have no defense. I mean, it's an open and shut case. And your livelihood, your practice is over. And as much as a lot of my patients love me and appreciate me and all this, front page of the paper, Dr. Britt gets sued for malpractice and loses, you can imagine what my name will do in this town. I'm done. I can shut my doors, I can pack up my bags, and I'm gone. And so for all intent and purposes, my career in Madison is over if I got sued like that. And so that's always in the back of my mind. And it's always in the back of Dr. Israel's mind, and the internist, the ER doctor, the OBGYN. You know, in medicine, if there's a bad outcome, and I hate to tell you this, but we're all going to die. If there's a bad outcome, somebody gets sued. And it doesn't matter if it's little Aunt Susie that you think is like family to you, she might be the one to sue you. I mean, every day we're told these stories, and friends tell you a story, or you read an article in a magazine about the person that you never expected sues you, because that's the society we live in. I had a patient one day come in, he got hit in a car wreck, and he looked over at his wife and he said, "Yo, I came here to get checked out and stuff, and I just went to my lawyer, and the lawyer said, cha-ching!" He said, I'm gonna cash in on this one." And she said, "Honey, don't say that to the doctor." But that's the mentality that a lot of us have now. If we get hurt, cha-ching. You know, if the doctor screws up, cha-ching. And unfortunately, we have to think about that. And if you're at all conservative, studies will show at least 20% of healthcare cost is us totally defending ourselves. There's an article I read about, I don't know, maybe 2 weeks ago. They surveyed doctors, and they admitted that 50% of the tests that they do are purely to defend themselves. 50% of the tests they do. So when you look at the healthcare dollar, and you look at this big pie chart, you start thinking about MRIs and CAT scans and blood work, and I'm sure if you guys have ever gotten a bill from the hospital, you know what I'm talking about. And if you thought, if I could get 50% of those off of that bill, I could save some serious cash. And so I see that as one big problem. And let me ask you guys, does this 2,700-page bill address that at all? And when I saw that, to me it said that they were disingenuous. They said that they wanted to make it better, they want to make it more affordable, they're trying to save it in the long run, but they leave out what the medical community says is their #1 concern. They left it out. They're disingenuous. I almost got a t-shirt or something today and wrote on with a marker and said, "They didn't ask me." You know, I wrote Baron Hill, he never wrote me back. I wrote Evan By, and I got an email back that didn't even address the question I asked him. But they don't ask us, you know, if we can help save them some money. But the second problem I see, I'll tell you a story. You know, I get tickled when I watch the president or one of the senators, and they're all the time talking about, you know, Mrs. So-and-so in Biloxi sent me a letter, and she said, "Thank you that my kids have insurance now." Well, I'll tell you a true story. I was in seeing a teenage girl the other day. Her dad's sitting there, and he's got crutches and a big knee brace on, and I know him. I said, "Tim, what's up with your knee?" He said, "Well, you remember I blew my knee out like 2 or 3 years ago, and I've been needing surgery, and I've been putting it off and off." And I was like, "Yeah." So I finally went 2 weeks ago, and I got it fixed. And I said, "Oh, you know, good. I'm glad you got it done." He said, "Man, I hate to see how much this is going to cost me." And I said, "What do you mean by that?" He said, "Well, you know, here in the next couple of months, all the bills will be coming in, and I can't, you know, I hate to see what it's going to cost me." And I said, "Tim, let me ask you something. If you were going to go buy a new truck, would you go down and pick out the truck you wanted, and then take it home, and then wait to see what it's going to cost you? I mean, would you go buy a new house and not even ask about the price of the house, just go pick out the house you wanted and go move all your stuff in the house, and then 2 or 3 months down the road, then go settle up on the house? I mean, would you do that with a house or a truck?" I can guarantee that knee cost him what a truck would cost. And he'll laugh, and no, I mean, you know, the insurance companies, I don't know. I mean, I have no idea what it's going to cost. I think the #2 problem in healthcare is this whole third-party payer system, where, you know, I'm seeing you, and I'm taking care of you, and you're coming to see me, but this guy over here is paying for it. And you pay him, but I negotiate with him the price, but you're the one coming in and seeing me. And you don't even know what he pays me. You know what you pay him, but you have no idea what he pays me. And it's all crazy. And there's, you know what, 400 or 500 people here today. You probably have 10, 15 different insurances, and I might get paid 10 different prices for all of you when you come in. And yet I might have to beg and scream and cry to get it from those insurance companies. I mean, why do we do that? You know what amazes me is that a friend of mine said this the other day. He said, "But Kevin, we'll never go where we're addicted to a $20 copay. So we'll pay $1,000 a month for our insurance to get a $20 copay." And I was like, "Neil, you don't understand. If you didn't have that $20 copay, it may only cost you $45. You wouldn't have to pay $1,000 a month for your insurance." "I don't know, but it's a $20 copay is what I'm addicted to. And if I didn't have that if it wasn't that $20 copay, I'd never go to the doctor." And it's like, you know, where do we get that mentality? Why does your employer have to pay for this insurance? Don't you understand that he could pay you another $2 or $3, $4 an hour? You could buy your own insurance, or maybe you could have a health savings account. A lot more people are getting those. And a guy the other day came in, and I gave him an antibiotic. He went down to the drugstore. He has a health savings account. He called back and said, "Man, that thing was going to cost $200. And I was like, "No, I'm sorry. Hold on. There's a cheaper one. It's more cumbersome to take. It'll do the same job, and it's $8 at Walmart." And I'll take it. You know, he was sold on it. And if you have that kind of control, if the patient is in control, and you guys know, well, I can get an MRI over here for $500, but if I go over there, it's $2,000, where are you going to go? You're going to go over there, it's $500, aren't you? And as long as the patients are starting to buy like you would go buy groceries, I mean, for crying out loud, you guys go down to Clarksville to save $2 on a pair of tennis shoes. I mean, I'm serious. You do that, but you won't. But you won't drive 5 miles to save $5,000 on a CAT scan. Oh, the insurance thing, I don't know. You know, it's the insurance, and I got a bill 6 months later and I owe $3,000. So what I'm suggesting